This is Andrea Zworich. In 2015, she was diagnosed with a blood cancer known as multiple myeloma. Because the cancer causes bone fractures, Zworich says she was often in excruciating pain.
I remember some of that pain was so excruciating, even like a car drive for getting a ride to the hospital, driving myself was very painful.
Today, her cancer is in remission, but when it was active, Zworich was in and out of the hospital. She says at the time she lived in Saskatoon and had her family close by. They helped watch her son while the single mother received treatment. Zworich now lives in Hanley. She says as a social worker, she sees cancer patients in rural areas face more challenges, including being away from home and loved ones to receive treatment and finding transportation.
Transportation just from hospitals or general areas to city, larger urban centers is a huge, significant barrier for rural populations.
Dr. Julie Stackew says for cancer patients in remote areas, sometimes getting to an urban center for treatment is half the battle. Stackew says she'd like to see more supports to help remove what she calls administrative barriers.
Anything we can do to make the journey just less challenging for patients and their caregivers, taking some of the load off of their shoulders so that really they can focus on the cancer only.
CTV News reached out to the Ministry of Health and the Saskatchewan Cancer Agency. The SCA says there are currently many supports for patients in rural and remote areas, including $40 a night lodging near cancer centers, virtual support programs and services, and some medications that can be sent by mail. Zworich says having family around and a place to go home played a key role in her cancer journey. Support she hopes everyone can have access to. Stacey Hine, CTV News, Saskatoon.